Welcome back to Medicare Explained. Today we're going to be going over Medicare Part D, also known as prescription drug plans. It's going to be a prescription drug coverage. I've come to learn that Medicare does love having multiple names for the same thing. So in this case, Part D is also known as PDP, just short for prescription drug plans. Getting into it, how do you obtain these? You got to get these from private companies, like for example, Blue Cross Blue Shield or United Healthcare, Humana, etc. Now the premiums, they can range. I've seen them be as low as $0 a month or all the way to over $100 a month. It's going to depend on what you're qualified for and what plans are available in your specific area. Now, as for the coverage, they're going to cover your prescription drugs naturally. Now, they're not going to cover things like drugs for weight loss or weight gain, so like your Ozempics, or drugs that are covered under Part A and B. And they're also not going to cover over-the-counter medicines. It will cover some medical supplies, for example, needles for insulin. Of course, it will also cover things like your insulin, if you're getting from like gabapentin, hydrocodone, etc., those prescription drugs. Now, it is a little bit of variance when it comes to that because the plans themselves, the carriers can pick what drugs they choose with some regulation. So, for example, if you were on a specific insulin like Humalog, it might not be covered by the plan, but a different one would be. And so, little things like that, you got to make sure you're paying attention to so you can keep track of that, make sure your prescriptions are covered. Now, prescription drug plans have what's known as a max out of pocket. This is the most you could pay for your prescriptions throughout an entire year. For 2025, that yearly max out of pocket is going to be $2,000. And again, that's over the year. That's the most you can spend on your prescriptions. Should you hit that, you'll be paying $0 for your prescriptions for the rest of the year. Now, if you already have prescription drug coverage through your Medicare, you may be familiar or have heard of what's called the coverage gap or donut hole. I want to let you know that that is not a thing come 2025 because of that new max out of pocket. They're no longer having that donut hole for you. You're not having to worry about that any longer. Now, one of the things that is carrying over from 2024 moving to 2025 is going to be the Part D IRMAA. Now, that stands for the Income Related Monthly Adjustment Amount, which is essentially a penalty. So it's additional payment for prescription drug coverage through Medicare if you make $103,000 a year or $206,000 if you're married. And again, the additional payment is determined by Medicare. They'll be able to give you specifics if you are making over that much in retirement. Now, the Medicare prescription drug program is a whole new thing that's coming out for 2025. What it allows you to do is to take your yearly cost for your medicines and pay that in monthly installments. Now that's going to include your copays, premiums, and deductibles. It's going to be all rolled up, added up, I should say, and it's going to be divided into your monthly installments. Now, enrollees will pay nothing at the point of service, which means that when you go to the pharmacy, you're not having to pay them, it will be billed later. And you can opt in or out at any time. If you do choose to opt out, you'll continue to pay any amount owed, and you must continue paying at the point of service, which again will be like your pharmacy, or if you're doing it through the mail, it'll be charged to your credit card there. Now, there are some additional costs here. For example, the cost of prescriptions. We're going to start with that. And prescription costs can vary due to multiple different factors. The first one is going to be what tier it's on. So all prescription drug plans have what's called a formulary. They'll have different tiers for different prescriptions. Your generics will generally be tier 1s or 2s, brand names being 3 and 4, so on and so forth. And some plans even have a tier 6, which is a tier that normally would cost you $0 for. Another thing that will differentiate the price is going to be the amount. So, for example, you have drug A that's on tier 2 and drug B that's on tier 2. If you're getting 60 of drug B and 30 of drug A, you may pay a different amount due to that. And of course, getting a brand name is always going to be more expensive. Now, some plans don't always cover the generic version or the brand name version of a specific drug. That's why you always want to double check when you're applying for that coverage, whether or not the drug you take it will be covered, whether it is you're taking the generic or the brand name. And it's very important to mention, I want to make 100% sure I go over this here. Medicare does not offer its own prescription drug plan. You must get it through a private carrier. For, like I said earlier, Blue Cross Blue Shield, Humana, United Healthcare, Cigna, Aetna, etc. There's so many companies to choose from, but you must choose from one of them. The good news is that most of these different companies have multiple different plans in a given area that'll cover different prescriptions or have different costs on these prescriptions and have different premiums, etc. So you'll be able to find one that fits your specific needs. And there's also a penalty for not enrolling into prescription drug coverage when you first became eligible, when you first got your Medicare Part A or Part B. And the penalty is going to be 33 cents per month you went without having coverage. Now, the penalty, while will apply to most people, doesn't apply to people who have drug coverage in another way. For example, if they have a plan through an employer, if they're getting their prescriptions covered by, say, the VA or TRICARE, or if they're using the Indian Health Service to cover their prescriptions as well. Then, of course, you wouldn't qualify for that penalty, which again is going to be an additional 33 cents per month you went without having that prescription drug coverage. And naturally, no one wants to pay any penalties. So even if you don't take prescription drugs, you still want to have that prescription drug coverage. Like, for example, if you went to the dentist and got a tooth removed, you're going to need antibiotics, which you're going to need a prescription for. You're going to want that prescription drug coverage just for things like that, even if you don't take any kind of prescriptions on a constant basis. All right, now as far as prescription drug coverage goes with Medicare, that's all there is really to it. Of course, if you do have any questions, feel free to put them in the comments below. I'll go over them and answer them for you. You have a wonderful rest of your day. I'll see you in the next video.